How would you like to feel more confident detecting murmurs and other abnormalities? My colleagues at Echo Health have created a 21st century stethoscope that's truly amazing. Using the Echo digital stethoscope and app is like nothing I've ever experienced in 30 years as a nurse. Echo is backed by 4 million heart sounds and FDA-approved AI that analyzes while you listen. Echo provides amplification, noise cancellation, and Bluetooth compatibility, and you can actually see heart rhythm data right on the device. With the Echo app, abnormalities are flagged in seconds, everything you hear is instantly recorded, and the exam flow feature walks you through every step of your assessment. You can even create a PDF summary of your findings to share with your colleagues. Right now, you can get $50 off plus a free customizable chest piece cover at echohealth.com/Keith, and your purchase is even HSA and FSA eligible. Plus, Echo guarantees you'll detect heart and lung conditions more confidently, and if you don't, just return it for a full refund. Go to echohealth.com/Keith for $50 off plus a free chest piece cover. That's ekohealth.com/Keith.
Nursing in the last 5 years, honestly, for employers have put a lot of effort into improving what that profession is day to day in terms of investing in career advancement and flexible schedules and so on. And they've put a lot of programs in place and there's a lot more options and so on. We're only just starting to see that for technicians and technologists.
What's the state of the nursing profession in 2025? The data speaks volumes about where we are and where we're headed. And we're going to talk about it with Iman Abuzeid, the CEO and co-founder of Incredible Health, right here on episode 518 of The Nurse Keith Show. Hey there, this is Nurse Keith. As always, this podcast is about you and your personal and professional development, your career, and the healthcare system writ large. And I'm here to share education, ideas, and informative interviews with some of the most inspiring people from the worlds of healthcare, nursing, entrepreneurship, and medicine, and beyond. I love having you along for the ride, and I thank you from the bottom of my nurse podcaster's heart for being part of the growing Nurse Keith Nation. If you'd like to help other people find the show, you can leave a rating and review on Apple Podcasts. That is really, really helpful, more than you can possibly imagine. You can also become a patron at patreon.com. That's patreon.com/Nurse Keith. There's a bunch of people that give about $2 a month to help the show as a way of saying thank you for the value they get from the episodes that they hear. So if you'd like to do that, I'd be ultra grateful. You can also share the show with anyone who you think might enjoy it. And no matter how you're interacting with us, including listening right now, I'm so grateful that you're here. You can go to nursekeith.com to find the show notes and all the links mentioned in this episode right at nursekeith.com in the drop-down menu labeled podcasts. The show notes are also on any app where you're listening on whatever device you choose to find podcasts like this one. And as I said, today we're here with Iman Abuzeid. She is the CEO and co-founder of Incredible Health. And Iman has been on the show more times than any other guest in the history of the Nurse Keith Show. And Iman, I'm always happy to have you here, and I'm so happy to see you. And the last time you were here was episode 438, and that was in 2023. And we were talking about the state of the nursing profession based on the survey that you had done in 2023. And my understanding is you've done a new survey for 2025. And I'm curious, did you again survey like several thousand nurses to kind of come up with the data to show you what's happening out there?
Yeah, thanks for having me on the show. So what we did was we analyzed data from over 1 million nurses that are on our platform on the Incredible Health Marketplace. For the first time, we also analyzed data from technicians. And then we did like in-depth surveys with over 3,000 nurses too.
Wow. So 1 million nurses, that's from the users who have your app or have logged into the website and are kind of like members of Incredible Health. Is that?
That's correct. Yeah, that's exactly right. Yeah. And so we have quite a lot of hiring data, proprietary data in our marketplace. about our users. So some of the information is collected from that too.
Right. Because Incredible Health is a platform where nurses and now technicians and nurse practitioners connect with potential employers and vice versa.
That's correct. Yeah, we have this vision and mission of helping healthcare professionals live better lives and helping them find and do their best work. And what we are is a two-sided marketplace that is software and AI enabled. And so nurses, technicians, nurse practitioners use our software and our apps to find permanent roles. And they also use a lot of our free tools and services that help them manage their career too.
Right. That's great. I know you have all sorts of tools on the website. So, in terms of what you've found, the data you and I are going to talk about, is that specifically related to nurses, or does it also relate to techs and or NPs?
So we have all three categories.
Okay. So they're all
um,
mixed together.
yeah.
Okay. All right. So tell me a little bit about where we find ourselves around the shortage. I know that some of your findings show that almost three quarters, like 71% of nurses say the shortage has impacted their work in some way. So what does that look like? Like, what have you gleaned from that data and what nurses have to say about the shortage?
Yeah, so 71% of nurses are saying the nurse shortage has impacted their work in some way. Specifically, what they're referring to is 80% of them are pointing to an increase in stress when there's
Mm,
shortages of workers. There's also 73% point to more responsibility with fewer resources. So, and then 69% point to reduced time for patient care. So
mm.
those are really the major implications that impact care and team morale that comes from the nursing shortage, right? Ultimately, it does affect the nurse's well-being,
Yeah.
and it manifests itself in stress, in more responsibility, and not enough time with patients.
Yeah. Which none of us like in our day to day work, of course. And just because you all interact with techs as well, is there a shortage in the tech space, like ultrasound techs and et cetera? Like, are there the same stressors and the same lack of personnel in certain markets that are causing people duress in their jobs too?
Yeah, there is. So for technicians and technologists, some of the biggest labor shortages in healthcare are in those areas now. There's a health system executive that I'm thinking of who describes the technician shortage of 2025 like the nursing shortage of 2021. I mean, I think we all remember what 2021 was like in nursing.
Mm-hmm.
And the reason for the technician shortage is we haven't increased the number of schools. In fact, the number of schools that train technicians has gone down by 15% in the US. And then our demand for services that technicians and technologists provide has increased, right? So we're doing more surgeries than ever before, more complex surgeries than ever before. We're also doing there's much more demand for imaging services too, across all the modalities, whether it's X-ray or CT or MRI. And so all of that's just leading to more and more demand for technicians and technologists, but we haven't done a great job of increasing the supply of them to meet that demand.
And I know this might not be part of your data, but I'm just curious your personal insights. And I mean, you talk to a lot of people, right? So you have your finger on the pulse of a lot of stuff going on. Why are there fewer technician training programs in schools? Do you have any insight about that?
Yeah, it's similar to the reasons why we still don't have enough nursing schools either. Um, the fact there's not enough people who want to join the faculty and do the training. The training of these professions is relatively expensive, especially the clinical training. And so as a result, we just, don't have enough, even though there are so many applicants that want to get into nursing school or want to become technicians.
Wow. And I can only imagine like nursing schools have like some of them have very high fidelity training centers, where people can train without working on a real patient, et cetera, all that sort of stuff. And it makes me think about just, I'm wondering about technician training. You know, a school's not going to go out and buy a CAT scan machine so they can train students how to use a CAT scan machine. I mean, that's like outrageously expensive. So they have to
It is.
learn like, real live, you know, CAT scan lab, right? I mean,
That's exactly right. And just keep in mind these are all regulated professions, right? So unlike becoming a software, when you're become a software engineer, you don't have to do any kind of clinical training, right? And you can
right,
become a software engineer self-taught if you want. But these are professions that are regulated, that have licenses, that have certifications, and many of the regulations require some form of clinical training that's, in person with patients.
right. Yeah. It's very problematic. And, the need out there for care is so great. And these shortages are just ongoing. And I mean, it was happening before the pandemic too. So we can't just like blame the pandemic. But I mean, there's all sorts of forces at work out there. And I'm curious, aside from the shortages themselves, what do nurses say that they either are getting or aren't getting or they want from their employers? And in your experience, is that getting better? Is it getting worse? Or is it just sort of the same?
I honestly think it's gotten better. So, what we're hearing from nurses in terms of what they want from their employer, it really boils down to a few different areas. One is they want more career advancement. And we've seen health systems invest more in career paths and career tracks for nursing and more professional development, more formalized professional development for them. So, that has definitely improved and increased. We are also seeing nurses request more flexible schedules. Um, and we've definitely seen some improvement there, where now there's more employers offering a menu of options for schedules, whether it's full time or part time or um, weekend shift options or 4 hour shifts or 8 hour shifts or 12-hour shifts, essentially many, many different options to try to retain their employees. And then we're also seeing a lot of requests and demand for compensation, more compensation. That's an evergreen topic. It comes up in our
Why
surveys and
not?
reports every year.
Yeah.
So 66 this year, 66% of nurses still do not feel like they're fairly compensated for their role. Um, and we've seen in our data shows that wages for nurses has gone up consistently every single year.
Hmm. Yeah. And if we look at the, the country as a whole, it just feels like everything is so expensive now. Like, I mean, you go out and like buy beans and they're so much more expensive, or toilet paper or milk, like staples that used to be cheap, or relatively cheap. Things feel really expensive. And when it comes to like cars and homes and rent and utilities, I mean, life is really, really expensive now. And it's understandable that a professional who's put in so much time and energy and blood, sweat, and tears to like become competent and or expert, that they want more money in exchange for their labor. I mean, makes total sense to me.
Yeah, to just address what you just mentioned. I think in this year's report, more than any previous year, it really highlighted the impact of the macroeconomic environment on nurses. So,
Mm-hmm.
55% of nurses say the housing market and interest rates have limited their ability to consider jobs in other cities. 66% of nurses reported that the macroeconomic climate has also influenced their career choices and their career trajectory. So
Wow.
I think what you're saying is spot on. I mean, the external pressures and the cost of living challenges um, are very much impacting this group of workers.
Right. And maybe you want to move to a certain part of the country, a certain metropolitan area, but then you look at housing costs in that area or transportation or schools or whatever, and you realize it's completely untenable. And, you know, whether you can land a job that is, equal to that cost of living is a question that I think many people need to ask themselves when they want to relocate. And retirement is often an issue that comes up when we talk about the workforce. There's been numbers for many years now pointing to this like wave of retirees. Nursing is no exception. So have you found that that has changed since your last survey or over the last couple of years?
Yeah, a couple of years ago, there was definitely a more than 20% of nurses wanted to leave the profession altogether. We've definitely seen that number come down a lot. So
Mm-hmm.
those that have trained as nurses want to stay in that career. So that's a positive movement that's happened. But yes, we're all facing the risk of, not the risk, but the challenge of retirees. The average OR nurse today is 48 years old, right?
Right. Yeah. I mean, I've been a nurse 29 years. I'm 60 years old. So, I'm in that cohort. I've been at it for a long time, right? Um, and other than retiring, there's always a lot of career movement happening for a lot of professionals, and nurses and techs and NPs are no exception. And I just did an episode recently. It was a quick solo episode about what I perceive in terms of nurses wanting to leave acute care, like wanting to jettison out of the hospital environment for many, many reasons.
Yeah.
And, I know you have some findings around that,
Yeah.
and I don't blame them. And what do you think is going on when it comes to people wanting to maybe look at non-acute facilities or maybe even home health? Because I know Incredible Health now posts home health jobs on your
Uh,
platform, so you're getting data about that.
We are, yeah. So we've expanded beyond acute care. We have over 1,500 hospitals in the country on our platform. We're now the biggest career marketplace for healthcare workers in the U.S. And so we've expanded from hospitals to surgery centers as well as to home health organizations too. And so our findings show that 51% of nurses that work in acute care are actively considering switching to a non-acute facility. And the main reasons for that are work-life balance. So 64% of them are thinking about doing it for work-life balance reasons. 54% are because of they want to reduce their burnout. And then 36% of them want to do it for a better schedule, a more flexible schedule.
Yeah. I mean, my listeners have heard it before that I've never worked in a hospital in 29 years, by very personal choice. And that those reasons have a lot to do with it, though there's other reasons too. But yeah, I mean, I like ambulatory care. And as much as there are judgments by certain nurses who feel that, when you're not working in the hospital, it's not, just doesn't have the gravitas. It's not like real nursing, but I think we've come a long way to seeing that nursing is pretty multifaceted. Um, and I know that the technicians and technologists, of course, they work in acute care, but they also work in outpatient
They
settings.
do.
So, are,
Mhm.
is there any movement in that direction? Are more wanting to be outside of acute care, or is it not as stark as what you're seeing with nurses potentially?
So with the technicians and technologists, it's not as the movement from acute to non-acute or desire to move from acute to non-acute is not as intense as it is for nurses. But they're struggling with the shortages as well, right?
Mm-hmm.
And they're more than ever before are because they have shortages. They're dealing with more stress at work, more burnout, and unlike nursing, the employers haven't come along. They haven't made as much progress on things like career advancement and flexible schedules for technicians and technologists compared to nursing, right? So like nursing in the last 5 years, honestly, for employers have put a lot of effort into improving what that profession is day to day in terms of investing in career advancement and flexible schedules and so on. And they've put a lot of programs in place and there's a lot more options and so on. We're only just starting to see that for technicians and technologists.
Mm-hmm. Well, okay. Well, hopefully they'll continue to see gains too. And I'm glad there's some gains that you're tapping into that nurses might be kind of being able to take advantage of. at this time in history. I mean, that's a great thing. And I'm glad nurses are seeing the needle moving in some ways. Because I've been having a feeling talking to a lot of people that, you know, all of the pandemic hearts and flowers of heroes work here and all that kind of stuff, like, that was all well and good. But what I wanted to see when the rubber hit the road was that things would get better for nurses and everybody else after the pandemic. And I think some people have felt that all of that all those apparent gains were lost on some level. But
Mhm.
then it's good to hear that some people feel like things are getting better.
Yeah.
And, you have some data about the number of people planning to leave their roles this year. And you intimated a little bit about it a couple of minutes ago, but you seem to point to that there's more people planning to stay in healthcare till retirement. Is that, do you feel
Correct. Yeah.
like
So
that's some positive movement?
yeah, the positive movement is that nurses are staying in their profession, but they are looking to change jobs, right? So the turnover for the annual turnover for nurses has come down a little bit. So it used to
Mhm.
be over 20% of nurses are changing jobs per year. And
Wow.
it's the industry benchmark shows around 17%. So it's improved a little bit. Um, and that's also reflected in our surveys, right? So, or in our report too, where it shows that it's less than 20% of nurses that are looking for another job this year, but that's still like a really large number that are looking to change jobs.
Right. Right. And, their main concerns remain things like management, leadership, staffing. 'Cause, I mean, when are we ever going to get away from staffing being an issue? And then you also mentioned pay and benefits, which is totally understandable. And like you were saying, in the macroeconomic environment right now, I mean, it's hard. It's hard for a lot of people.
It is.
And it sounds like uh, there is talk out there too about safety. You know, COVID highlighted some safety issues that I don't think we need to beat anybody over the head about right now because they've all heard it before.
Yeah.
But what do you think about workplace safety? Where
Yeah.
do people find the main issues are for them when it comes to feeling safe and being safe at work?
Yeah, that's exactly what I was about to bring up
Oh,
too.
I see.
In terms of one of the other reasons they look to change jobs is they're experiencing some amount of workplace violence, right? And so the
Mhm.
hope is that their next employer has just addressed safety concerns much more than their current employer. So our data shows, our report shows that 46% of nurses were verbally or physically assaulted by a patient or a member of the patient's family in the past year. That is very
Mhm.
consistent with last year. It was around 50% last year as well, which is kind of an astonishing stat. One in two nurses has dealt with some level of workplace violence in the last 12 months, right? That's just a really sad state of affairs. And it's unfortunate that our healthcare professionals are dealing with that
Mhm.
head on, especially nurses.
Yeah.
And some of the factors that nurses believe is contributing is that there's more patients that are in a confused or altered state that they're dealing with. They're also patients that are frustrated with wait times that are too long. Again, another consequence of the shortages. Um, there's also frustration with the high patient to staff ratios. Like I can't see my nurse or I can't see the healthcare professional who's supposed to be taking care of me because they're taking care of so many other people too. And so all of that increases the frustration from patients, which sometimes manifests itself in verbal and physical assault. Again, not acceptable at all. And there's a lot that organizations can do to continue to limit it, um, including hiring police instead of regular security.
Mhm.
We also have seen employers put in place zero tolerance policies. Um, we've also seen employers lobby their local and state governments for a change in the penalties for those that abuse healthcare workers. or assault healthcare workers. So, there's things that can be done. It's not just like a problem that we should just be tolerating, but the magnitude of the problem is very significant, and these numbers have increased through um, in the last few years, since COVID.
Yeah. Yeah. I always make the assumption that the workplace violence and assaults happen a vast majority in acute care. And I think that's probably a pretty good assumption. And, because that's really the front lines on in many ways, and I'm sure there's stuff that happens in ambulatory care, but acute care, I think, is where that's kind of where the tinderbox kinds of conditions can occur. So,
Yeah.
I worry about my fellow nurses and healthcare providers in acute care. So of course, we all hope it's going to get better. And I want to take a break. And when we come back, I want to talk a little bit more about some of your results from the survey and the data that you've crunched. And then I want to talk some about changes at Incredible Health and what you're up to. And then we'll wrap up. But hang in there with us, and we'll be right back with the second half of episode 518 of the Nurse Keith Show with Iman Abuzeid, the CEO and co-founder of Incredible Health. Hey everyone, let's take a quick pause for the cause, shall we? Thanks for being a valued listener of the Nurse Keith Show. And if you'd like to help other people find the podcast, please consider leaving a rating and review over on Apple Podcasts or Spotify. This really helps propel the show and grow our audience. And I truly appreciate everyone who's already taken the time. And if leaving a public rating review isn't your thing, why not tell a colleague about the Nurse Keith Show by sending them a link so they can listen for themselves? After all, word of mouth is the most organic way for me to reach those who truly need to tune in. So if you'd like to do me a solid, please consider leaving a rating review or telling a friend or colleague. And by doing so, you'll be helping the Nurse Keith Show reach more and more nurses and healthcare professionals all around the world. Now, let's get back to today's conversation. And welcome back to the second half of the episode. We're here again with friend of the pod and my friend and colleague, Dr. Iman Abuzeid. She's the CEO and co-founder of Incredible Health. And you may not know that Incredible Health is the largest career marketplace for permanent healthcare workers out there. And as she shared in the first half, it's not just nurses, it's also NPs and technicians and technologists who are connecting with employers on the platform and vice versa. So, Iman, everybody and their mother is talking about AI. You just can't look at the news without hearing about AI. And not that it hasn't been around for actually decades, but, when the large language models came out a few years ago, everything just sort of, it's been an inflection point and we all know it. And we're all kind of tired of hearing about it, but we have to talk about it because it's reality. So what do you think's going on with AI in the workplace and with the workforce in healthcare? And what do you glean from the nurses you talk to?
Yeah, I think AI more generally is probably going to impact many, many people's jobs, many roles. But I think a lot of the rhetoric has been about job replacement with AI. I think the impact in healthcare is a little bit different. I think AI job replacement in healthcare is not likely going to happen. However, I think the roles are going to change because of AI. We're seeing that nurses and technicians aren't necessarily being replaced, and no one's even talking about replacing them, honestly, but they are looking to use AI to support and empower them in their roles. Some of our findings show that the number of nurses who believe AI is going to negatively impact their roles has dropped from 64% of nurses saying that last year in our report, and that's dropped to just 38% are now
Wow.
believe that it's going to negatively impact their role.
That's a big drop.
That's a very big drop.
Mm-hmm.
I think last year there were a lot of findings around there's still an enormous amount of fear, uncertainty, and doubt among nurses regarding AI and work. But that certainly has come down a lot over the last year. And interestingly, now majority of nurses, so 85% of nurses are now saying they want more training on how to use AI, which really reflects the rising level of comfort that they have with AI and the desire for more upskilling when it comes to using AI.
Mhm.
Um, they're seeing that AI has the ability to save time for them on administrative tasks. They're also highlighting that AI is being used to increase process efficiency or improve process efficiency, and to improve their technical training too. So they're starting to see some of the benefits, which is a good thing.
Mhm. Yeah, and if you just think about it, you know, if a AI can assess, I don't know, let's just say 2 million MRIs and collate all that data. And then you take your results of your MRI and you have the AI scan it and compare it to all of that data that has been looked at, which a human being could never, even an enormous team of human beings could never look at all that data and put it together. There's a lot of benefit. Or if you have a digital stethoscope like the people at Echo make or other companies make, and they have, millions of heart sounds and lung sounds that the AI is kind of like consumed and crunched and can compare and contrast. I mean, where else can you get that kind of data analysis but from those sorts of machine models. And, I mean, when any technology comes along, there's always fears of jobs being replaced, like the locomotive, the telephone, the telegraph. I mean, personal computers. And yeah, some jobs do get lost along the way. I mean, it just happens, but I don't see nurses going anywhere. And I mean, you need a technologist to sit someone down and talk them through an MRI and put them on the table and conduct the test. I mean, a robot can't really do that. And I don't see robots doing that anytime soon. So, do you feel like that fear of like robots are coming for my job is just not quite as pervasive and intense as we may have seen at other periods?
Yeah, I think the fear of AI among healthcare workers at least has dropped dramatically,
Mm-hmm.
especially in the last year. And
Yeah.
I think part of that's just like not when you mentioned when the LLMs first came out and so on, and ChatGPT was live.
Yeah.
There was just a lot of uncertainty, not and like not understanding the technology, so on. And I think we've worked through some of that. And so now many of us are using AI even in our personal lives, right? So
Yeah.
it's just much more familiar. And so that naturally the fear has come down. Having said that, our report still showed that nurses have some concern about AI and the harms it could cause at work, at least. And so some of the concerns they have are losing personal connection with patients.
Yeah. That makes sense.
Yeah, they're also concerned about over reliance on AI over human judgment.
Hmm. Yeah,
Um, and then they're also concerned about misinformation because of an increase in misinformation because of errors from AI.
absolutely. But I think as more of us become comfortable with it in our personal lives than in our professional lives, or vice versa, the comfort level increases. Like I was talking to a coaching client the other day. She uses it she uses ChatGPT to like make shopping lists and come up with recipes and, decide on different things in her life, and even like to examine her cover letters that she's working on for applying for jobs. So I feel like there's a lot of utility, and I mean, there's always fear about the unknown. So it's understandable.
Yeah.
And the hype out in the media doesn't help, of course, right?
No, it doesn't. I mean,
There's a
from even from just our own experiences with adding AI to the incredible health marketplace and
I was
seeing
just
how
going to ask you about that.
yeah, so we've and at the end of 2023 we became the first healthcare career marketplace to launch many generative AI features inside our marketplace. And probably one of the most popular features was what was our Gen AI resume wizard. So
Mm.
we'd uncovered that 30% of nurses start their job search without a high quality resume.
Hmm.
for a variety of reasons. Could be because of socioeconomic reasons, or they may not have a laptop, or they may maybe not have clear guidance on what makes a high quality resume. But you need a resume, right, to get access to any job.
Yeah.
And so we were like, okay, so let's create this resume wizard where nurses can create a high quality resume in the Incredible Health mobile app, which is free, right?
Hmm.
Within seconds.
Hmm.
And it'll be high quality enough to meet the requirements of an employer.
Right.
And we saw the uptick of this feature grow dramatically, right? Well, after it was launched.
I have no doubt. Yeah. And, as a career coach, I help people with their resumes, and I'm definitely seeing change that, and no shade to you all. There are platforms like Incredible Health that are helping nurses and other professionals create pretty amazing resumes, I've got to say. And my utility as someone creating resumes for clients is definitely fading. And I'm okay with that, because there's other things I can do. Because an AI can't sit and talk with one of my clients about their lifestyle and their kids and what kind of life they're trying to create for themselves, and the vision of what their world is. The resume thing, I'm totally cool with, people being able to make resumes and cover letters using AI,
Yeah.
because it's just as good as better, or better than what I can do. So I'm totally fine with it.
Yeah. And
And
it frees up the coaching time on
other
for other
things,
areas, right? Yeah.
yeah, the more creative things and the deeper conversations that I can have with my clients. So I'm totally into it. I'm totally cool about it. Um, so we just have a couple more minutes, and I wanted to ask about nurses' opinions, or the technologists and technicians, about kind of like politics here in the US. What's going on? How do people feel like politics is having any impact on their work, their patients, how they do their work, anything at all? Like, what are you seeing? What are you hearing?
Yeah. What we're seeing, and this really came out in the report we just
Mm-hmm.
published, that the uncertainty that healthcare workers feel around national policy is they believe it's going to impact them in the workplace. Um,
Mm-hmm.
and so, for example, 88% of nurses anticipate the potential Medicaid and Medicare cuts will
Oh, yeah.
negatively impact the healthcare system, which
Right.
will turn affect their jobs in the workplace. Um, 63% of nurses believe that the current political environment will have a negative impact on their job or workplace.
Yeah.
So there's definitely some level of pessimism from the majority of nurses when it comes to when it comes to our national policies or potential national policies and the impact it's going to have on their jobs.
Yeah. And that all remains to be seen. It's a moving target.
Right.
And, we all have different places we land with where we are politically. And that's not a place I really go on this show, because there's plenty of other places people can go for those conversations.
Yeah. I mean,
Um,
same here. Like,
yeah.
yeah.
Yeah. There's, I don't even have to say it, but there's a lot that can be said, and a lot of debate to be had. But, overall, what I hear from your report is that I get what I see: 65% of nurses that you spoke to would recommend a career in healthcare. I think that's actually pretty good. I think
Yeah.
that's pretty
Very
decent.
positive.
Yeah. Based on all the challenges, like, shortages, staffing issues, workplace violence, to hear 65% would still recommend a career in healthcare isn't that bad in the bigger picture. So I'm heartened by that. Are you heartened by that?
Definitely. I think that it's at the end of the day, despite the challenges, it's a profession that um, provides some level of financial security to many families across the U.S. It's also a profession that has helped many Americans move from one socioeconomic class to the next.
Yeah.
Um, it is still a profession with an enormous amount of employment. I mean, this just then, I mean, we see it on our platform. We know the numbers nationally. The number of jobs available is definitely much more than the number of professionals available.
Yeah.
Uh, so it's you're almost always going to be employed, right?
Hmm.
So,
Right. And, the other piece of good news that I take from your survey findings is that there's still a generational divide, and there always will be, no matter what generation we're in or whatever we're measuring. That's just ubiquitous. But it shows that 41% of nurses said they don't feel helpful about the next generation coming up in terms of healthcare professionals. But in 2024, you showed 68% weren't hopeful. So to me, that's pretty massive improvement, don't you think?
Yeah, absolutely. That's a huge
Yeah,
improvement.
I think that's great. And, you know, before we close, I just want to ask you, like, Incredible Health has expanded. You have, you know, AI generativity. You were the first out of the box with all of that. You now have nurse practitioners, nurses, technicians, and technologists in the healthcare marketplace. You're the largest healthcare marketplace for permanent workers. What are you excited about when it comes to the future of your company? Because it's an amazing company,
Yeah.
and you've done an amazing job. You and I have been talking on this show. I think this is the fifth time. So Incredible Health's come a long way. So tell me something you're excited about in terms of the next couple years in the life of Incredible Health.
Definitely. Yeah. I mean, I can't believe I've been on the show for five times. I
I
mean,
think so.
honestly, you've actually seen our whole entire journey, which
Hmm.
is pretty amazing.
Yeah.
We started this company 7 years ago.
Hmm.
So we speak, you and I speak every 1 to 2 years.
Yep.
Um, and I remember the first time speaking with you, the marketplace was only available in California,
I
and
remember that.
so now, fast forward 7 years, we've grown to over 1 million US nurses and nurse practitioners on the platform. Earlier in 2025, we expanded to technicians and technologists. We also now partner with 1,500 hospital locations, including very big health systems like Tenet and Ascension and Trinity, and lots of regional systems like Kaiser Permanente and Providence Health, and lots of academic medical centers like Johns Hopkins and Cedars-Sinai and others. Also, at the beginning of 2025, we expanded to surgery centers and to home health organizations too. And we've become now the largest software and AI-enabled career marketplace for healthcare workers. I think what's coming up for us in the next few months is more AI features. So what we have live today is the resume wizard that the nurses absolutely love, that they use to generate resumes. We also use AI in the messaging that goes from employers to the healthcare workers. It helps the employers differentiate themselves from their competition, and that has resulted in a 20% increase in nurses accepting their interview requests.
Awesome.
Uh, of course, we use AI in the processing of profiles and resumes as well internally. Um, but there's definitely more coming. We're investing pretty heavily in AI, not just for the nurses and healthcare workers, but also for the employers.
That's
Um,
great.
so we're really excited about that. And then the other things we're working on are really just continuing to add to the free tools and services we provide to help to nurses and other healthcare workers. So
Right.
we've been on that journey for many years. We provide continuing education and salary estimators in a community where they can ask each other for advice. But there are going to be more social features are being added right now, and more to come. More to come there in terms of just more free tools and services for nurses and other professionals.
That's really exciting. That's great. And people can go to incrediblehealth.com, and then the app is available on all the app stores, right?
Correct. Yeah, for
Yeah.
free. And all of our services are 100% free for healthcare workers.
Yeah. That's wonderful. Okay. So before we go, I may have been doing this when you were last on. I have a few quick questions I ask at the end, but they've sort of changed, I bet, since you were last here. Actually, a couple have changed recently. So can I throw a few quick lightning round questions at you?
Yeah, let's do it.
Okay. So first one is, this is actually a new one. You're the first one I'm test driving this one on. What's something you've always wanted to learn or do, but you've yet to have the time or opportunity to explore it? And it could be like a hobby, it could be anything. Like it's just something that's like, you know, you just haven't quite been able to do it yet.
So I speak English and Arabic, but I've always been interested in learning more languages. Just
Oh, yeah.
haven't had the
Yeah.
time to do it or
Yeah.
haven't prioritized it.
I hear you on that. I was in Turkey and Greece in the fall and I was like practicing both and they were hard. And I was like, I need to go back and practice more. So good excuse to travel though. Okay. So next question. What's a perfect day off like for you? Like, so what are some of the things you like to do to make a day off feel like a day off? Because you're a hardworking CEO.
I am, yeah, I do work a lot.
I know you do.
I probably a self. I'm a big fan of self-care days. So if I get to sleep in, go to the
Hmm.
spa, get a massage, go for a walk, like those are just like the best days. Yeah.
Yeah. Yeah. So just stuff that nurtures your body or your mind or your soul. Yeah. That makes sense. Okay. This one could be hard for some people, but I'm curious what you might have to say about it. If you could choose an entirely different career path and you're an MD, you have an MBA, you're a CEO and a co-founder of a huge billion-dollar company, is there another career like some people harbor like, man, in another life I'd be a baker? Like, do you have one that just
Ew.
would be one of those dreams in a different life?
Interior designer.
Yeah.
Yeah.
Oh, cool.
It's a hobby right now, which I do just for myself. And I'm really into it, but I could see myself doing it professionally if I
Mhm.
was.
Yeah, that's cool. I like that. Okay, last question. I may have asked you this one last time, but your answer may be different. So, if we named you Queen of the World tomorrow and you could do everything in your power to make people's lives better and there were no holds barred, what would be the first thing you'd want to do? Just like wave a magic wand and improve people's lives. Like, what's the first thing you would want to tackle?
I would want to just make education completely free.
Hmm.
K through 12 plus college, you
Yeah,
know, or college slash vocational school.
it's the key to many things, isn't it?
It is the key to many things, and
Yeah,
it's been a key for me. Just the opportunities I've had over the years, they all really do originate from having a great education.
yeah, yeah. Well, we're lucky you had that education because you've done amazing things with it. So,
Thank you.
yeah. So thanks for coming back, Amon, and thanks for being here. And I'm glad to get this update from, the million nurses who you're able to glean data from. And thanks for creating this marketplace for nurses and NPs and technologists. And, I appreciate what you all are doing and I love having you come back.
Thank you so much for having me. I'm a huge fan of the show. I am a patron of the show.
Oh, thanks,
uh,
Amon.
and so, just, yeah, I love what you're doing here and hope it continues.
I appreciate it. Thank you. Well, there you have it. Thanks for listening to this episode of The Nurse Keith Show. The show notes are at nursekeith.com. They're also on the app where you're listening on whatever device you happen to use. And remember, please go to incrediblehealth.com and check out all their free stuff and also download the Incredible Health app. I hope you've uplifted and empowered from this episode. If you need holistic career coaching to elevate your career, check out Nurse Keith Coaching at nursekeith.com. Mention the show and get 10% off your first coaching package, understanding that you could probably have an amazing resume made over by the resume wizard over at Incredible Health. We are proud members of the Health Podcast Network at healthpodcastnetwork.com, and we're produced by the inimitable Rob Johnston of 520R Podcasting. Before we say goodbye, I'll leave you with this quote by Maya Angelou. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. Be well, dig deep, seek joy, keep in touch. This is Nurse Keith saying adios till next time from beautiful Santa Fe, New Mexico, and my friend and colleague, Dr. Iman Abuzeid, saying arrivederci from
Atlanta, Georgia.
All right. Thanks, Iman. Thanks to everyone for listening, and we'll catch you on the proverbial flip side.